Hello, health psychology students. Welcome to the class. Ideally, you have read over the syllabus or watched the little video clip about the syllabus and the requirements for the class. And my plan for today is to start lecturing on what is health psychology. I am a licensed psychologist. I'm a clinical health psychologist by training with my PhD. And this is going to be a big take-home point all throughout the semester, whether this is about you personally with the Behavior Change Project, or if you are going to be a future healthcare provider, that human behavior, our emotions, which we sometimes call our affect, our cognition, which are our thoughts and thinking habits, all of this is absolutely critical to health. And this kind of fits into one of the psychological orientations that we follow is called cognitive behavioral therapy. CBT is how we abbreviate it. And it's the idea here that our behavior affects our feelings. Our feelings affect our behavior. Our thoughts are a driving force in determining our behavior. Our thoughts are a driving force in determining how we feel. And these three things are integrated. And we're just really going to hit this home this semester, how important our whole being is to our physical health. So what is health psychology? Health psychology is represented by Division 38 of the American Psychological Association. I'm a member of Division 38. And I know 1978 sounds really old to you young people in this class, but in terms of different fields of psychology, health psychology is a baby. Okay, it is a young field. In this field, we merge psychology. It's interdisciplinary with the field of medicine and with the field of public health. We study, this etiology is a fancy word for cause. We study causes of diseases scientifically. We are here to promote health in people. We are here to prevent illness in people. We get involved in public health care policy with government agencies, state, federal. We are really trying to improve the healthcare system. And later on in this lecture, we're going to go into more detail about that. And the field of health psychology fits a little more into primary prevention. Primary prevention is when you're doing preventative interventions on healthy people to keep them healthy. So keeping healthy people healthy. An example would be, getting vaccinated for COVID, masking back in the day when that was more important, that type of thing. So health psychologists really focus on prevention. The field of behavioral medicine is slightly different than that. And in this situation, we're doing behavioral interventions as medicine. So instead of taking pills as medicine, doing a surgical procedure as medicine, we're doing the behavioral interventions as medicine. So here it's the application of psychology and other social, behavioral, spiritual services that are evidence-based, so they have the scientific backing to help people who are diseased. And I want to pause here for a second, because normally when we think about disease, we're thinking about medical illness, which is appropriate. But the roots of the word here are diseased. And I want us to just kind of think about this, that when we have medical illness, that creates dis-ease, that creates our own personal stress, because the medical illness could be hurting us. It could be adversely affecting our lives. It could mean lost productivity. We're not able to take care of our family, go to work, that type of thing. But I also want to camp out here, and I want you to realize that being dis-eased, being stressed, for many of us makes us physically ill and gets us to actual medical illness. So the mind body is tied together here. And I just wanted us to kind of think about that. There are a variety of professionals that practice behavioral medicine, and the professionals who practice behavioral medicine, oftentimes we call that integrative medicine, where we're integrating the behavioral services in with the traditional biomedical medicine. These professionals are usually practicing at what we would call the secondary or the tertiary levels of prevention. Secondary level would be where people have signs or symptoms of disease, and we're trying to prevent that from going and growing into full-blown disease. So that might be an example, might be treating high blood pressure with relaxation techniques or meditation to prevent the high blood pressure from causing a myocardial infarction, which is a heart attack, or causing a stroke. Tertiary prevention is really what we think about as medicine, where a person has a medical diagnosis and we are treating that medical diagnosis, trying to prevent that from getting worse, or we're trying to prevent death. And so typically we call that treatment interventions, or we call that rehab medicine when we're trying to prevent death. And the people that practice behavioral medicine are usually at the secondary and tertiary levels of prevention, whereas the health psychologists are oftentimes at the primary level of prevention. Okay. Some other definitions, integrative medicine, and we've got a wonderful documentary on that called The New Medicine for you to watch, is when we can combine mainstream medical therapies and CAM therapies where there's scientific evidence for safety. And again, we psychologists, when we do this, we call it practicing behavioral medicine. CAM, complementary and alternative medicine, is in the healthcare system practices products that are usually not considered to be a part of conventional medicine. So as an example, at the end of this lecture, we're going to talk about red light therapy. That is not considered to be the typical treatments for a lot of things that light therapy is used for. So that would be considered complementary and alternative medicine. To give some credence to this, one of the branches of the National Institute of Health, NCAM, is the National Center for Complementary and Alternative Medicine. And that is the federal government agency that sponsors high quality CAM research, which is how we get to the evidence base, where we get to the scientific backing and the evidence base for the things that we do. Public health, many of you know this, it's a branch of medicine for public health, and it factors in hygiene, epidemiology, disease prevention, and management. Public health really kind of shone when we had the quarantine portion of the pandemic, in helping people get tested for COVID, helping people get vaccinated for COVID. And then in our country, in the United States, we have separate, our public health and our health insurance are separate. In our sister countries that have universal health care or socialized medicine, the public health and the health insurance are the same thing, where people pay in their taxes to public health, and then any health care that they need, they go and they get for free. They've paid for it in their taxes, but they're not paying for it out of pocket. They're not paying for it through insurance. We have an insurance industry. So privates like Cigna, Blue Cross Blue Shield. Examples of the public healthcare would be Medicare, which is 65 and older and comes from our federal taxes. Medicaid, which is state level. Medicaid tends to give health care to individuals that are considered below the poverty line, particularly children, as well as adults that are below the poverty line. And keep in mind, the poverty line is different per state. So yeah, it's just different per state. So Medicaid is state funded and Medicare is federally funded. And we don't have these things well linked in our country. Very interestingly, the countries that do have those linked, our socialized sister countries, actually at the beginning of the COVID pandemic handled things much more smoothly than we did, because they had already coordinated their public health with their healthcare system, and we had not. So just some definitions to put some of these things in context. The biopsychospiritual model is the model that we embrace, and that model tends to be different than the traditional biomedical model. Sometimes that's called Western medicine, sometimes it's called allopathic medicine. Most of our healthcare system is built on this, and the system is you go in with what ails you. Usually a nurse sees you and does a few things like take your blood pressure, whatever. Then you see the medical professional, who could be a medical doctor, could be a physician's assistant, nurse practitioner. And then they make a diagnosis, and then they oftentimes will prescribe medications. In some other situations, they might want to do a procedure or do a surgery to correct the problem, but it's all biomedical focused. In integrative medicine, on the other hand, we embrace all of this. So we think about the whole person, the biology driven down to the organs, the cells of the organs, the chemistry, and even the physics. We embrace the psychology, which is the emotions or affect, the cognition, which are the thought patterns and behavior. At a social level, we embrace the importance of interpersonal relationships. And I've got a whole lecture on social support later on in the semester. And then we embrace things like institutions. An example would be, are you insured or are you not insured? Are you in school? Are you a part of certain groups of individuals, as an example? And then all the way up to the spiritual level. And at the spiritual level, this can be organized religion, like Judaism, it could be Catholicism, it could be Christianity, but it doesn't necessarily have to be organized religion. But at this level, we're focusing on, we might be focusing on spirituality that is not necessarily connected with an organized religious group. We're focusing on people's sense of meaning and purpose in life, their connection in life. It could be a connection to God or Allah, as an example, or it could be a connection to nature being important for that individual. And we focus a lot on values. We're going to talk later about acceptance and commitment therapy that spends a good bit of time focusing on individuals' values and are they leading a life that is embracing and in the same direction as their values. In ACT, we call that, are they following their true north, as an example. And it could be even the mystical, the stuff that we sort of like, we feel, but we can't see, we can't touch, that type of thing. So in this model, we really think about the whole person well beyond a medical diagnosis and a medical treatment. We think about all of these other very important things in our lives. Okay, now let's talk a little bit about leading causes of death, and I'll talk a little bit about some of the fluctuations that have occurred in the last, say, 5 years with the pandemic. The number one cause of death for people in the United States has been for a long time coronary heart disease, which is mainly death from a myocardial infarction with what we call a heart attack. And half of all of our deaths are coronary heart disease. There is a myth in our culture that women don't get heart disease and that the leading cause of death is breast cancer, and that's just not accurate. For women and for men, coronary heart disease is the leading cause of death, but women are protected against cardiovascular disease, which is both heart and head, and peripheral vascular disease, up until menopause. So women don't start seeing symptoms and escalation until around 50, 51 for most women in the United States. But because of that myth, we know that women are not treated nearly as aggressively by first responders, and they're even not treated as aggressively when they present to an emergency department when they're having a heart attack. There's even some interesting data. If you're a woman and you suspect you're having a heart attack, you want to see a woman in the ER. You don't want to see a male provider, because women are a lot more likely to test for and treat aggressively heart attacks in the ER. So that's number one cause of death. Number two cause of death is cancer. And we're going to spend about 2 classes on cancer at the end of the semester. It's about 23% of all deaths. And a half of men and a third of women will have cancer at a diagnosable cancer in their lifetime. COVID just hit the number 3 here during a portion of the pandemic prior to vaccines. And then we had the big burst of Omicron. COVID actually rose up and became number 1 cause of death. And at this point in time, it is now settled back for number 3. And keep in mind, COVID doesn't kill, it's complications from COVID. And the most common complication from COVID is death by pneumonia. And a lot of that is because of the cytokine storm that can occur where the immune system just goes crazy in trying to fight off COVID. Number 4 on the list are unintentional injuries or accidents. We're going to talk a little bit more about that here in a bit when we talk about young people. And keep in mind, when I'm talking about this list right here, we're talking about all Americans. And the number 1 predictor of death is age. And so a lot of this stuff occurs as we get older. And that's going to make sense to you when we start talking about heart attacks and Alzheimer's and things like that. Number 5 on the list is cerebrovascular disease, which we call stroke, where a person loses blood flow. Either they've got a bleed, or more common, they've got clogged arteries in the brain. And either a portion of the brain dies and the person lives. In this situation, we're talking about a massive stroke where enough of the brain tissue dies that that person dies. Chronic obstructive pulmonary disease, which is mainly emphysema. These are oftentimes individuals that are on oxygen tanks. So chronic obstructive pulmonary disease, COPD. Then Alzheimer's disease, which actually we've been paying more attention to. We used to think it was this thing that you got, or was this genetic predisposition. And now we're thinking a lot more about Alzheimer's disease as being lifestyle related. Diabetes, both type 1 and type 2, chronic liver disease, nephritis is kidney disease. And then number 11 for all Americans is suicide. Okay. And you can kind of see it visualized in terms of prevalence here. And you can also see, we've got some differences between these 2 years here, but you can really see how incredibly common heart disease and then cancer and then COVID are for people in America. Now, this is a health psychology class, and the psychology piece of this is going to be focused on behavior. And so if we think about coronary heart disease and we think about risk factors for stroke, you've got sedentary lifestyle where people are not moving and they're not physically active and exercising. You've got dietary factors. You've got things like tobacco use, and that would include things like smoking, dip, and vaping. You've got things like individual stress levels. You've got things like, are they socially disconnected and lacking in social support? You've got things like access or not having access to healthcare, but lots of lifestyle risk factors for coronary heart disease, the same risk factors for stroke, and actually about the same risk factors for diabetes and maybe even Alzheimer's. When it comes to cancer, the number 1 behavior that is driving cancer is use of tobacco products. So cigarette smoking, vaping, dipping are going to be risk factors here. We know stress is a risk factor. Things like being exposed to toxic chemicals is a risk factor. Here in the cancer deaths. And the unintentional injuries and the accidents, we've got things like motor vehicle accidents, which would be particularly driving recklessly, driving and being distracted with a cell phone, and particularly if an individual is in an accident and they are not fastened in their seatbelt. Other types of accidents there would be like accidental overdoses of medications, particularly substances like opioid deaths would factor in here. Chronic obstructive pulmonary disease, the main risk factor there is cigarette smoking. And now we've got vaping on the scene, and then things like having an occupational hazard. So like working in the coal mines and getting lung cancer or emphysema from being in the coal mines, asbestos, so like shipyard workers who are exposed to asbestos are more likely to have COPD. Alzheimer's, you got the genetic predisposition and certainly age being a predictor. But we're also talking nowadays about this thing called type 3 diabetes and lifestyle factors that are driving problematic circulation and nutrition in the brain for Alzheimer's. Diabetes, you've got the sedentary lifestyle, the nutritional stuff. We get metabolic syndrome and obesity kind of mediating between lifestyle and development of diabetes, and that kind of mediates in the development of Alzheimer's. Chronic liver disease is mainly chronic substance use, chronic alcoholism, and in some cases, certain medications that damage the liver, as well as hepatitis, different types of hepatitis damaging the liver. Kidney disease, nephritis, these are usually individuals that end up, if they have access to it, going on dialysis to clean their bloodstream, and death from kidney disease. This is driven mainly by diabetes that is not well controlled, damaging the kidneys. And then suicide, suicide risk factors would be an untreated psychological disorder. And then suicide risk factors are access to lethal means. So having particularly guns available for a person who is suicidal. And so hopefully you can see here when we start looking at the pattern of what kills us, the disease that gets us, and then what kills us here in the United States, we see quite the pattern of lifestyle behavior and psychological influences factoring in here. Okay, so that was all Americans, and we talked about how age is a predictor. But interestingly, I do want to talk about a little bit. We oftentimes think about a lot of the things we think about for aging, like wrinkles and weight gain and all that kind of stuff. Actually, a lot of what is confounded in what we think about in aging is actually an unhealthy lifestyle repeated over more than less years. So some of the stuff we think about as aging is not inevitable. Some of the stuff that we think about as being normal aging is actually unhealthy lifestyle accumulated across a lifetime. And then again, doesn't it make sense that age would be the biggest predictor of death? When we look at young adults, however, we get a different pattern, and that makes some sense. Unintentional injuries or accidents is number one. And interestingly, motor vehicle accident deaths have been on a decline. A lot of that is because people are wearing their safety belts all the time. We've got all these safety features in vehicles that really have helped reduce, when we do crash, reducing those deaths. But we're seeing a huge rise in drug overdose death. A lot of that is opioids. A lot of that is driven by fentanyl consumption, whether it was deliberate use of that as an opioid, or you're hearing stories about people even, smoking some weed that was laced with fentanyl and dying because fentanyl is incredibly potent and lethal, as an example. Number two, suicide. And again, we've talked about the access to lethal means, but that is much higher on the list for younger people than it was for older people. Homicide. If you are a African-American male or a Latino male in a urban area that has gang activity, then homicide is the number one cause of death in young people in those situations. But it's number three overall for young adults. And some of this includes domestic violence. A lot of this is obviously death from gun wounds. Number four on the list is cancer for young adults. And those are things that we hear about: leukemia, brain tumors, lymphoma, neuroblastomas, bone cancer, retinoblastoma that starts in the eyes. Heart disease, number one for all Americans, but it's number five for young adults. Number six would be congenital abnormality, some kind of abnormality they're born with. Number seven, diabetes. I wanted to mention that because you saw diabetes on the other. And that's both type 1 and we're now seeing type 2, which we used to think was an old person diabetes. And now we're seeing that in children, teens, and young adults. I'm skipping 8 and 9, but I wanted to just let you know that number 10 is death from influenza pneumonia. And COVID's the number one underlying cause of that, where COVID complications result in pneumonia. And then there's death because the lungs fill with fluid and the person can't get oxygen to their body. So slightly different pattern here. We still definitely have behavioral factors, psychological factors, operating here for deaths for young people. All right, I'm going to conclude part 1, and we will resume with part 2 on the next video.